So we'll be starting rhinology today, ঠিক আছে? তো প্রথমে যেটা just একটা introduction দেবো anatomy উপরে। So this is the anatomy of the lateral wall of the nose, okay? So why the lateral wall is important? Because it contains many important structures, okay? The turbinates, the meatuses, okay? So we'll be starting the lateral wall of the nose. So the lateral wall of the nose is formed by the following bones, okay? As you can see, there is a nasal bone. So you can see this is the lacrimal bone, okay? The frontal process of maxilla, the nasal bone, the uncinate process of ethmoid, okay? The medial pterygoid plate of the sphenoid bone, the perpendicular plate of the palatine bone, okay? So these are the structures which are forming the lateral nasal wall, and along with there is the inferior concha. Why? Because inferior concha is a separate bone, okay? And there are certain cartilages, minor cartilages like the lateral process of the septal cartilage, the major alar cartilage and the minor alar cartilage. So these structures, they form the lateral nasal wall. Okay, so as I told you, this is the lacrimal bone, the bones which are forming, okay? So first we'll come to the what are the structures that are present in the lateral nasal wall, okay? So first is the anteriorly. Anteriorly in the area of the nostril, the line by the skin and the hair is the vestibule. So this is the vestibule portion. This is lined by skin and the hair, the front region, okay? And behind this area, it is structureless. Nothing is there. This is known as the atrium. And then what we have, the next important thing is the Agger Nasi. What is Agger Nasi, anyone? The most consistent anterior ethmoidal cell, okay? So this is the Agger Nasi in the X-ray, in the CT scan. You can see this is the Agger Nasi cell, okay? So bulge anterior to the middle turbinate is the Agger Nasi. There are three turbinates, everyone knows, middle, inferior and superior. Sometimes the fourth turbinate is also there, okay? So we'll discuss it later. So the Agger Nasi is the most anterior part of the ethmoid, okay? And it is represented by a small crest or mound on the lateral nasal wall, just anterior to the attachment of the middle turbinate. So this is the inferior turbinate, middle turbinate, just anterior to the middle turbinate is Agger Nasi cell, okay? So it may be pneumatized or non-pneumatized. So these are the structures. So in the CT scan, sometimes if the Agger Nasi is severely pneumatized, so we can see the structure here, which is the Agger Nasi cell in the CT scan. This is also the Agger Nasi portion, but it is not pneumatized. And this is a prominent pneumatized structure, Agger Nasi. So now we'll coming to the lateral nasal wall. Okay, so lateral nasal wall is marked by three bony projections called the turbinates or concha. So there are three turbinates: superior, middle, and inferior. As you superior middle is the part of the ethmoid bone, and the inferior turbinate is a separate bone. Okay, sometimes a fourth turbinate called the concha suprema may also be present. And below and lateral to each turbinate is a corresponding spaces called the meatus. So we have the inferior meatus, the middle meatus, and the superior meatus. So what is the importance of this meatuses is that, so first the inferior meatus nasolacrimal duct opens in its anterior part. Okay, so nasolacrimal duct opening is in the inferior meatus. Middle meatus consists of the Bulla ethmoidalis. So this is very important, middle meatus, because it consists of Bulla ethmoidalis, Hiatus, Semilunaris, and the infundibulum. And three sinuses open into the middle meatus. Okay, so this is the frontal, the maxillary, and the anterior ethmoidal sinus. Superior meatus, the posterior ethmoidal sinus open into it. Okay, so then we have the sphenoethmoidal recess, which is the triangular fossa above the superior meatus, and sphenoidal sinus opens into it. Okay, so superior meatus is the posterior ethmoidal sinus, and the sphenoethmoidal recess is the sphenoidal sinus opens into it. Okay, so this is another important part, the eustachian tube. So question ashe eta opening of eustachian tube kothay thake jigesh kore onek shomoy, thik ache? The eustachian tube lies in the nasopharynx at the level of the inferior turbinate, 1 centimeter behind this posterior attachment. And in the nasopharynx, there are also two important structures, which is the fossa of Rosenmüller and the torus tubaris. So middle turbinate also an important structure. So it is a convoluted structure bending similar to a dried leaf. Okay, so it can be divided into three parts. So one part is a sagittal portion, the anterior 1/3 is the sagittal plane, and it is attached to the cruciform plane at the junction of the middle and the lateral lamella. Okay, the middle one is in the coronal plane and it is attached to the lamina papyracea, and this lamina papyracea is also known as the ground lamella because it stabilizes the middle turbinate and it separates the anterior ethmoidal cells from the posterior ethmoidal cell. And the posterior third lies in the horizontal plane and it is attached to the perpendicular plate of the palatine bone, extending up to the roof of the posterior corner. So this is a structure, it is a leaf-like structure. Okay, so this portion is attached to the cruciform plate of the frontonasal process. This is attached to the lamina papyracea and this is attached to the perpendicular plate of the palatine bone. So variations in middle terminal so also last minute now coming to the uncinate process, yes. So uncinate process, it's a superior extension of the ethmoid. Okay, it's a part of the ethmoid bone. So anteriorly it fuses with the posteromedial wall of the Agger Nasi cell and posteromedial wall of the nasolacrimal duct. Okay, and it is a free superior posterior edge. The floor and the medial wall of the infundibulum is formed by the uncinate process. So infundibulum is also an important structure, will come at later point. This is the uncinate process. Okay, so this is the Bulla ethmoidalis, this is the Hiatus semilunaris, and 3D like the entry point is known as the infundibulum. Okay, and this is the uncinate process. So now next coming to the another structure is the ethmoidal bulla. So it is the largest anterior ethmoidal cell. Okay, so occasionally the bulla may extend up to the base of the skull, and there are two recesses there, that is the suprabular recess and the retrobular recess, and together they form a space which is known as the sinus lateralis of Grunwald. These retrobular and suprabular recesses together. This is Hiatus semilunaris. So Hiatus semilunaris, what is there are two part. Okay, so one is Hiatus semilunaris superioris and one is Hiatus semilunaris inferioris. So this Hiatus semilunaris inferioris that leads into the infundibulum. Okay, and the Hiatus semilunaris superioris that leads into the sinus lateralis of Grunwald that we discussed earlier. So what is that? This is the cleft between the ethmoidal bulla and the middle meatus. So this is the structure. See, this is the suprabular recess, the retrobular recess. Together, the most important structure is the osteomeatal complex. Okay. So what are the structures which forms the osteomeatal complex? So osteomeatal complex is lateral to the middle turbinate and is often in function referred to as osteomeatal complex. So what are the structures which are forming it? The uncinate process, the bulla and the intervening infundibulum. Together they form the osteomeatal complex. Okay, see, this is the bulla, this is the middle turbinate, this is the infundibulum, this is the uncinate process. So this structure forms the osteomeatal complex. And why it is important? Because anterior ethmoid, the maxillary and the frontal sinus drains into the osteomeatal complex. Suppose in cases of sinusitis, what happens? This osteomeatal complex gets blocked, and what happens? Sinus in the maxillary sinus is draining into the osteomeatal complex. So that is the main pathology in case of sinusitis, blockage of the osteomeatal complex. This is the infundibulum, this is the Hiatus semilunaris, this is the uncinate process, and this portion is the osteomeatal complex. Okay, ethmoid air cells. Now this is the most important. Okay, so the anterior and the posterior ethmoid air cells may pneumatize the surrounding structure. So if it pneumatizes the frontal bone, it forms the frontal cells. If it pneumatizes the lacrimal bone, it forms the Agger Nasi cells. If it pneumatizes above the sphenoid, that is known as the Onodi cells. So these are the cells which is formed by the ethmoidal air cells. Okay, and if it pneumatizes the roof of the maxillary sinus, that is known as a Haller cell, and if it pneumatizes the middle turbinate, that is known as the concha bullosa. See, what is Haller cell? It's infraorbital ethmoidal air cells just below the orbit. Okay, these are ethmoidal air cells located anteriorly to the ethmoidal bulla along the orbital floor. And what is the significance? If Haller cell is present, okay, it may cause mucociliary drainage obstruction, predisposing to the development of the sinusitis. This is the Haller cell, infraorbital ethmoidal air cell, present along the floor of the orbit. Now coming to the next, that is the Onodi cell. So Onodi cell is formed by the lateral and the posterior pneumatization of the most posterior ethmoidal cells over the sphenoid sinus. So what is the significance of Onodi cells? The presence of the Onodi cell increases the chance that the optic nerve or the carotid artery would be exposed in the pneumatized cell. So see, this is the Onodi cell. See, if Onodi cell is present, there is a chance of optic nerve getting exposed during, in case of sinusitis, when we go for the FESS operation. So this, we have to take the presence of the Onodi cell and the Haller cell. These two cells are very significant. So the last portion will for today is the maxillary hiatus. So what is maxillary hiatus? So it is bounded inferiorly by the maxillary process of the inferior turbinate. posteriorly the perpendicular plate of the palatine bone, and anterosuperiorly a small portion of the lacrimal bone, and the superiorly the uncinate process and the bulla of the ethmoid. Okay, so this is the maxillary hiatus or maxillary ostium opening. So this is the maxillary ostium. Okay, this is the uncinate process, this is the superior turbinate, and these are the infundibular cells. And generally what happens, sometimes we can also see an accessory ostium. So here this is the accessory ostium and this is the opening of the maxillary sinus. So this is the accessory ostium. This is the opening of the maxillary sinus. Okay, this is the maxillary ostium which leads into the maxillary sinus. This is the sphenoethmoidal recess which opens into the sphenoid sinus. And this is the uncinate, the inferior turbinate. This is this portion. The last for today is the ethmoidal infundibulum. Okay, so what is ethmoidal infundibulum? It's a cleft-like three-dimensional space in the lateral wall of the nose that belongs to the anterior ethmoid. Okay, so the boundaries are medially is the uncinate process, laterally is the lamina papyracea of the orbit, and posteriorly is the anterior surface of the ethmoidal bulla. See, this is the uncinate process, this is the anterior wall of the bulla, and this is the ground lamella. And this is the posterior ethmoidal cells. Okay.